learning objective for lesson 5 is applying the logic to specific reports typical of those submitted to National Pharmacovigilance Centre. We'll look at a probable and a possible example and how we might assess them. We will start with 2 examples where the suspected adverse reaction is interstitial nephritis with omeprazole. Interstitial nephritis is an inflammation in the kidneys, in the tissue between the functioning parts. It is also one of the typical immune responses to a drug, although it can occur spontaneously. The interstitium becomes inflamed and therefore swollen, and the functional elements in the kidney are compromised, leading to renal failure. This image shows normal renal histology with glomeruli and tubules, the functioning parts, packed closely together. There's very little tissue between. In the next slide, we see an enlarged interstitium with many inflammatory cells in it. In recent years, this has been identified as an adverse reaction to omeprazole and then other proton pump inhibitors. The incidence is about 1 in 12,000 patients exposed, but it is frequently reported because PPIs or proton pump inhibitors are so widely used. So here is a probable and a possible report. I won't tell you which I think is which. Here we have a 76-year-old female. She was taking a standard dose of omeprazole, 20 milligrams daily, which she took for 4 months. She was taking diltiazem and bendrofluozide, and the report said she had interstitial nephritis, poor appetite, and fatigue that developed 3 months after she started the medicine. She continued her other medicine, stopped the omeprazole, and she recovered. And then we have a 68-year-old male patient also taking 20 milligrams of omeprazole daily. He took it for 5 months and developed the same disorder. He was also taking azathioprine. He stopped omeprazole and continued azathioprine and had not recovered at the time of the report, sent 3 days after omeprazole was stopped. Take a minute to consider how you would classify each of these reports and why. I would classify the first report as probable, given the reasonable time relationship to onset, the response to D-challenge, and the continuation of other possibly suspect medicines after she recovered, making them unlikely causes. However, I would follow up how the diagnosis was reached unless this was a well-known adverse reaction. I would classify the second report as possible. It was sent too early for recovery to have occurred after stopping omeprazole, so there are 2 suspects, omeprazole and azathioprine, as azathioprine is a known cause of interstitial nephritis.